Hello, and welcome to the Providence Regional Emerging Special Pathogens Treatment Center training. I'm Christa Arguinchona, and I'll be leading you through today's training. Today we are demonstrating a spill cleanup of body fluids or other spills for a patient in a biocontainment unit infected with a high-consequence pathogen such as Ebola. A defined process to contain, clean, and disinfect a spill should be followed to maintain safety of the patient and healthcare personnel. Healthcare personnel performing the cleanup should wear appropriate personal protective equipment or PPE for the pathogen. Today we will be donned in the high-level PPE ensemble that we use for Ebola and other high-consequence pathogens. A spill kit containing a mop head, a biohazard bag, absorbent pads, and paper towels is kept in the patient room. Other supplies you will need are hand sanitizer, disinfectant wipes, and a mop and mop bucket with the appropriate disinfectant. Once a spill is identified, the healthcare personnel should call for assistance. This spill cleanup procedure usually involves 2 caregivers to maintain the culture of safety. If the spill is very small, one person may perform the cleanup process if a trained observer is monitoring that process. Today I am joined by Katie and Brooke from our Special Pathogens team to assist with the spill cleanup demonstration. When cleaning up a spill in the biocontainment unit, we want to contain the spill, clean it, and disinfect. So go ahead and start by containing the spill and creating a visual parameter of the spill that identifies the area that needs to be cleaned. If it's helpful, use towels to contain and create barriers for the liquid spill. Take the supplies out of the bucket and line the bucket with the red biohazard bag, or position an already lined garbage can in an accessible location. Ensure that hand sanitizer and disinfectant wipes are easily within reach. Clean the spill by layering it with enough absorbent pads until all the fluid is absorbed. Once the fluid is absorbed, place a pad with a fluid-resistant backing on top with the resistance backing facing up. Gather and bundle the pads, keeping them enclosed in the outer pad. Use tongs or a grabber tool if that is helpful. Gently place in biohazard-lined garbage can or bucket. Examine the area, and if evidence of spill remains, perform hand hygiene and repeat the layering process with absorbent pads until the spill is no longer visible. Perform hand hygiene, doff outer gloves and gently discard, then perform hand hygiene again and don clean outer gloves. Disinfect the area using disinfectant solution with a mop and mop heads. If the spill is very small, it may be appropriate to use disinfectant wipes with a mop handle to clean up the spill. Once the area is mopped thoroughly, remove the mop head and pick it up with the grabber tool and place in the biohazard-lined garbage can. Perform hand hygiene, then gently remove the red bag from the bucket or garbage can and gooseneck tie it. Sanitize the outside of the bag with disinfectant wipes. Then you will double bag the waste according to your local Category A waste handling processes. Disinfect the mop handle and grabber tool with disinfectant wipes. Both caregivers will then perform hand hygiene, doff outer gloves, perform hand hygiene, and don clean outer gloves. When cleaning up a spill, remember these 3 things. Notify a second person to assist with the spill cleanup or observe the process if the spill is small. Utilize an established process and follow the checklist. And go slow to contain, clean, and disinfect the spill properly. Thank you for your commitment to keeping patients safe and your fellow caregivers safe.